Good morning, my senior colleagues. Um, Today we'll be talking about a visual reality visual field. I want to thank Dr. Smith because she literally spoke about it yesterday. There's been a paradigm shift from the conventional visual field we're all used to, that is bulky, very heavy, patients don't really like it, to virtual reality. And the good news is that it's here in Nigeria. It's We started using it in some centers in Nigeria. It's presently in UCH and is also in Asokoro District Hospital. And I know a lot of people, some other centers have also gotten it, and it brings very exciting news to us in Nigeria. So on a good day, when I tell patients, glaucoma patients, that, okay, it's time for you to do your test. Once I just mention test, their face changes and they start frowning and they say, doctor, which test? Is it that one that I have to press? And I'm like, yes. And I try to explain to them, you have to do it. That's the only way I'm sure that your glaucoma is not progressing. They're not listening to me. Doctor saying, can I do that test next visit? I'm already very tired. They'll be pushing it and pushing it. And that's the way it always goes. There are always so many complaints. They don't look forward to doing the test. It's very boring. The room is dark. A lot of times they sleep off. They have backache. They keep complaining. It's not, the positioning is uncomfortable. And there are issues with even adults cooperating for the test. It's a challenge for children. And then if you have multiple centers, you're into outreach, you do a lot of research, it's very bulky. In a country like Nigeria, you need constant light for the routine visual field. And it's difficult to carry it around to various centers. It's difficult to carry it around to outreach centers, rural centers. You literally have to have one in every place. And even when you're trying to do research in the community, it's difficult to carry it around. Well, here it is. This is it. And it literally solves all the problems I just listed below that your patients would usually complain about. And these days, when we're doing Oculera, the patients are no longer frowning. They are so excited. It's like they're playing a game and everybody is happier. I don't see those angry faces anymore. All I see are happy faces playing a game, and it's really, really good. So Oculera is, it's certified and registered with the Medicine and Healthcare Products Regulatory Agency for legal sale in the UK. So what are the features we have in Oculera? The printouts is similar. You don't have to learn anything new. It's just similar to the Humphreys visual field you're all used to, and we'll look at it very shortly. It measures the reliability indices, the mean deviation, pattern standard deviation, visual field index, and the glaucoma hemifield test. You don't need to learn anything. It's everything you've known before. It has additional features like eye tracking, and the test can, you need the internet to run the test. But the good news is that there's an offline model. So you can actually run the test even if you don't have your internet connected, and then upload it later. Sorry. And then it has cloud storage. Great news. You can do your progression analysis, and it has a voice assistant. So it even tells the patients what they're supposed to do. If they are doing anything wrong, it puts them back on track. It does all the work for you. In short, as your technician is so much relieved. Unlike the conventional visual field where he's saying, put your head here. When I go into to see the technician, most times he's just walking around. He doesn't really have to be there because his voice assisted. He does all the work. It also does a guided progression analysis, and it measures events. It helps to identify events that may affect the results, and there's also a trend analysis. So this is the result. Very similar. Like I said, you don't have to learn anything new. It's basically what you've known before. So you have your numerical scale, the gray scale, the pattern deviation, and the total deviation. And it has the same indices, like I had said earlier on. And then basically the same results. Everything you have on your standard Humphreys visual field is in the Oculera printout. Next slide. What kind of tests can we do with this? It has the 10-2, the 24-2, the 30-2. It has the C40 and the C76, which are supra-threshold tests. It has the estimates test, which is peripheral. And then it has strategies. It has the Oculera Interactive, which is similar to the CETA standard. And the test runs for 4 to 5 minutes. And then it has a fast tracking test for screening for glaucoma, and that's about 1 minute, 30 seconds. And its full threshold test is just about 8 to 10 minutes. And then it has the supra threshold test. That's the C40 and C76. What are the features that make Oculera great? The cost. So you can pay at once, and they have a package where you can actually pay monthly. You can pay monthly. The maintenance, they're telling you that you don't have to bother about calibration or maintaining Oculera. Once you have a problem with the device, they replace it for you. Is that not great? They will let us know. High mobility. This one, you can, one finger, very mobile. You can take it out on outreaches, rural, various centers. Next slide. It's easy to use for the patients. They can stay in any position. It doesn't have to be that strict. Put your head here. You can lean back, relax, and do your visual field test. Next slide. How many of you don't like this? And every patient has to use it. Well, for Oculera, you don't need the eye patch. Next slide. And you don't need that dark room that makes you sleep. Next slide. Okay, and I said it's a digital device. It works alongside the laptop. You can use it with your phone and a tablet. And it also has an offline model. Usually you would charge it. You don't need to use it with light. It's great for outreaches. It's great when you don't have electricity. It is so convenient. Studies have also proven that it has a very strong correlation with the Humphreys visual field analyzer. And presently, the good news is that there's a Nigerian study going on. So this Efizi machine, let's see how Nigerians do with it. How our market women, our fishermen, our cattle rearers, our bus drivers, our Okuda drivers, our professionals do with the visual reality, visual field compared to the standard Humphreys perimetry. So we're looking forward to the results of the study very soon. How to use, very easy. So it's here today. You can all see it, you can all feel it. The good news is you can also all use it here today. It's easy to wear, and that's it. So this virtual reality game for adults. So clearly sorts out a number of challenges with the conventional visual field test. It brings great hope to the future of visual field testing, and we look forward to what the Nigerian study would say. Thank you very much. Please, at this point, I would like to call Professor Olaoye to give us a few words on Oculera and her experience. Thank you. Just a few minutes.